for vulnerable populations with accurate and reliable scientific evidence. Without further introductions, please join me in welcoming Dr. Alumni. Yes.
Good afternoon, everyone. Today is a very special day for me, and it's honor, pleasure to stand here to share with you my personal story, as well as the key findings of my PhD project that inspired me to have a presentation talking about reducing gender inequality for ethnic minority women. I would like to share with you a topic about reducing gender inequality for ethnic minority women, a comprehensive policy approach. And I'm going to share with you the following contents, my personal story, and a summary of my PhD research. And before making the conclusions regarding the policies and programs that aim to improve health for the ethnic minority women, I'm going to would like you and me to review some existing policy and programs. So thank you, Ms. Hoàng Yến, for introducing me, and so I will omit these sections, and I will tell you why I'm interested in gender inequality. Firstly, there are several reasons, and one of that is my family story. So in my childhood, I frequently witnessed my mom being bullied by my dad. He is a daily drunk. So my mom couldn't bear anymore, so she divorced. And after divorce, she had to brought up her 3 daughters by herself, including me. I'm the youngest child in the family. And you know, I often saw my mom crying at night alone. So I see being a woman is still suffering. And I also observe and recognize that many other Vietnamese women around me are also suffering because of their bad husband. And more than that, because of the social perspective that women don't need to go to school. Women don't need to get a high level of education. She just stay at home and take care of her children and her husband at her best. That's it. So I vote to myself that I will study very hard and succeed in my life, and I won't allow anybody, especially my husband, bully me as my dad did with my mom. And it was because this great motivation. So I graduated from Ho Chi Minh City Medicine University with a high qualified degree, and I got a good job at the Ho Chi Minh City Institute of Public Health in Ho Chi Minh City. Then I was awarded an Australian Development Scholarship for my master degree, and then a QUT scholarship for my PhD. Thank you. Yeah. And you know, I tell my story as inspirational story for many girls and women I met in my life, and girls in my family, and those that I met in my business trip in the Mekong Delta. And I encourage girls and women try to study well to get a good qualification so that they can have a secure job and have secure income, that they can be independent. And now I will share with you the key findings of my PhD project that provided very valuable information for making more effective policies and programs to improve the health for ethnic minority, especially the Khmer in the Mekong Delta. And I would like to improve. I hope that the information can help the policymakers to improve the policy for the minority groups in other regions across the country. So the holistic hypothesis of my research is household food insecurity, lack of healthy, diverse diets, and inadequate water sanitation and hygiene. They may interact, and then they have a compounding impact on physical and mental health of the women. This project was conducted in 2017 and 2018 with the involvement of 552 women. Actually, the primary food preparers in the house, but 82% of them are women in Đồng Tháp and Trà province. Đồng Tháp is a southern province of Mekong Delta, and Trà Vinh is the southern province of Mekong Delta. And this project included 3 stages. Stage 1 and 2 are the qualitative study and the pilot study to ensure the reliability of the study instrument. And the study instrument had 2 components, a structured questionnaire and an observation checklist. In the main survey of stage 2, data on socio-economic factors, agricultural activities, household diversity, household food insecurity, WASH, and self-reported physical and mental health of the primary food preparers were collected by interview trainers and using the electronic tablets. And the observation checklist collected data on the water storage and the cleanliness of the surrounding of the household, as well as the conditions and the types of sanitation facilities and hygiene practices of the household. The food and nutrition security framework underpins this research because it allows me to investigate the association between household food insecurity, care practices, and healthy environment, including health services and water sanitation. So you can see that there are 2 other frameworks integrated in this framework. On the top, that is the malnutrition framework. That is the malnutrition framework. And the other framework as integrated in this food and nutrition security is the sustainable livelihood framework. And malnutrition is a result of multi-sectorial and multi-dimensional causes. However, they can be divided into 3 categories. The basic causes underlying here, and then the gross one is the underlying causes, and on the top is the basic causes. And in my study, I investigated all of these causes of malnutrition and their links to health status. Okay, I will talk some more about the sustainable livelihood frameworks because it's very important for women to improve their livelihood and then their health status. So livelihood comprises the capabilities, assets, and including material and social resource and activities that require for means of living, and it is affected by the vulnerability context, which is on the left of our hand. And the vulnerability context include the shocks like diseases, illness, the negative impacts of disaster or climate change, and also the basic services, infrastructure, so political, economical, and institutional security, also gender and environment. There are 5 main capital assets in the livelihood. That is the human capital, such as labor, skills and knowledge, health status, nutritional status, and the physical capital like infrastructure, roads, vehicles, and agricultural tools. If people living in the rural areas and working with the farming. And we have five main capital: physical, natural, and natural capital. They are, for example, land and water, biodiversity, wildlife. The financial capital like wages, credits, remittances, and these capitals are very important for people to improve their life. And now I will share with you the key findings that provided me the evidence. So I recommend a comprehensive policy approach to support sustainable livelihoods, food and nutrition, water and sanitation hygiene to improve health, and reduce gender inequality for women, especially the ethnic minority women in the southern region of the Vietnamese Mekong Delta. So regarding the health status, the study found that the Khmer women were more likely to self-report mentally ill than their kin counterparts. And regarding water sanitation and hygiene, the Khmer household were more likely to not own sanitation facility, and they have limited hand washing facility, limited knowledge of hand washing facility with sharp, use less than 50 liters per person per day for potable use, and have improper water storage compared to their kin household. Regarding the ownership of livelihoods, the Khmer household were also less advantaged in terms of livelihood access. For example, they are more likely to be landless, more likely to have lower education levels, working as daily laborers, and they have more debts, fewer savings, owning fewer household assets and kitchen utensils, and they are more likely to get difficulty in accessing markets to buy food, and not belonging to a social organization, for example, cooperative, or agricultural cooperatives, or a women organization. Regarding the household food insecurity, the Khmer household were twice more likely to experience some degree of food insecurity in the last month or last year, and especially they were more likely to experience severe food insecurity compared to kin households. And you can see in this chart on the right, the severe food insecurity category, the percentage of the Khmer household that experienced food insecurity was 10% compared to just 3.6% or 4.7% of the northern and southern kin province kin households. And regarding the diet quality, the Khmer household were more likely to consume energy-dense and nutrient-poor foods, and their diet predominantly comprised of cereals, condiments, oil and fats, and lower consumptions of vegetables and fruits, especially those rich in vitamin A, and they are less likely to consume milk or dairy products compared to the kin household. We can see that the percentage of households that consume meat in the last day just 37.6%, especially very low for eggs, just 10%, fish and seafoods around 47.7%. And now I and you will review some policy and programs that to improve health and nutrition for women and children. And the global approach support for the dual actions, especially for the nutrition-specific interventions and nutrition-sensitive approaches. Nutrition-specific interventions that aim to address the immediate causes of malnutrition, like infant, young child feeding, child and maternal health care, prevention and treatment of severe acute malnutrition, micronutrient fortification and supplement, etc. Nutrition-sensitive approaches address with the basic and the underlying causes of malnutrition, like gender equality, social protection, clean water, adequate wash, and enhanced infrastructure. Internationally, we have the homestead food programs to improve health and nutrition for women and children. For example, Helen Keller International. This organization supports the community, especially children and family across 20 countries in the world, across Asia, Africa, Europe, and United States, to grow the nutritious food and to stay off malnutrition. And Helen Keller International helps the community to shape the entire food system. That means that first they help the community to grow their own nutritious food and then processing the food that they produce so that they can live longer, and then improve marketing so that the family can sell their food with and they can earn higher income and then improve their livelihood. And the Food Agricultural Organization, they have a project, Gender Employment Smart Agriculture, in which they support the women to build their resilient capacity, to improve their resilience capacity to the impacts of climate change and the other increasing risks like unstable prices and natural disaster. And recently, the UNICEF, they have the Joy Programming Wash and Nutrition. Yeah, they have this program to support the women and children under 2. They want the children and women live in a clean and healthy environment, that they can have access to optimal wash and nutrition services, so children are able to grow to reach their full potential. And this box is nutrition and wash actions that UNICEF is supporting countries. UNICEF is aiming. The Vietnamese government also set and implements some policies and programs to improve health and nutrition for the people, especially like the Resolution 34 on ensuring the national food security, and the National Strategy on Nutrition, the school meal program, and they especially focus on the ethnic minorities, provide milk for the children in the remote and ethnic minority areas. The other national targets program like rural development policy and programs reduce poverty, and they provide microcredit programs for the poor, providing rights for the ethnic minority and areas suffering from natural disaster, especially the water sanitation improvement for the rural areas. In northern areas, we have a very well-known nutritionist, Dr. Tu Giấy. He has his model to improve food and nutrition for people. The model names VAC, and Vietnamese meaning is Vườn An Chuồng. It is a vegetation aquaculture husbandry system, and it has that similarity with the home food programs of Helen Keller International. However, it is not widespread in the southern Vietnam. Other programs also conducted to improve food security and nutritional for children and women, like a community-based model for improving child nutrition status in Yên Bái for ethnic minority household. However, the problem is that these programs are predominantly donated by the NGOs, and they are limited, not widespread. The model is not widespread, and so like in the southern areas, the minority groups still have not many access to these programs. So in brief, the key findings of my research and the existing knowledge of food insecurity, also health status and nutrition suggested that the disparity in health between the minority and kin majority women, possibly due to lower ownership of livelihood capitals, more severe household food insecurity, poor diversity, inadequate wash for the ethnic minority women. That's why we need a comprehensive policy approach that can address multiple sectors because these problems may share the common drivers and solutions, so we can save. It will be more economic if we can solve a problem that share the common drivers and solutions, because resources are limited, and the evidence that siloed approaches show just modest effect, while integrated actions show maybe larger impacts on nutrition and people's health. And it is very important that the coordination is the core of the joint review actions, because it can help to bring different sectors together, and it is important to have an environment that can be conducive to collaboration between sector and programs. Thank you very much, everyone, for listening to me. Any sharing and question would be highly appreciated. Thank you.
Thank you, Dr. T. You did it within the time. Exactly 20 minutes. Thank you. And do you have any questions based on her presentation and her sharing? Yes, please.
Thank you for your really great presentation and the motivation to.
Can you hold a little bit, because we use the microphone so that the online participants can.
Yeah. Thank you for your great presentation. And I would like to have one question about the program that you already conduct in Đồng and Trà province. And I just want to say that after you already have a research on that, did you have any scans or any investigate that either any intervention or program or any organization already have a conduct intervention or program or support or do anything in Javan and Đồng province? So make a research and investigate or integrate your program in that organization.
Thank you for your questions. Yes, I find out the findings, and my ambition is that I can conduct an intervention to improve health status and nutritional status for the ethnic minority women and children in the Javan province, where I conducted my PhD research. Because when I conducted my research, I visited the Khmer household, and I got impressed because I see a little girl with her lunch, only some rice and salt, and she's very thin. Even though I don't measure her weight, but I know I can know that she's malnutrition, she's underweight, and her house just is a cottage, and this area is lack of water, so they don't have water even for drinking, clean drinking water. So how they can farm? Yeah. So that's why my study found the compounding impact of water insecurity and food insecurity on mental health and physical health of the women. So my ambition is I am trying to write a project, and I wish that I can find grant or support so that I can conduct intervention or a model linking wash and food security and nutrition and malnutrition. So my ambition is how can I connect sectors together, like in agriculture, gender equity, health, and wash. They all work together so that can improve the health status of the women in the ethnic minority and children in the ethnic minority in the southern region of Vietnam. And as far as I know, just at the time that I did my research, I did the literature, and I saw that there are limited, very limited projects or programs conducted to improve health for the ethnic minority in the southern areas. Why? There are so more programs, more projects conducted in the northern areas. Yeah, that's just what I saw at the time I did my research. And everything changes over time. I don't know now. So actually, I am connecting with the other Australian alumni in agriculture sector that I know in my intake. I connected him and I asked him about the situation is happening in the southern area so that I can drive the best project for the ethnic minority in the southern area.
So you can raise that to the alumni platform
Yeah.
You take reason and maybe you attract more people who interested in that and cooperate with you.
Yeah, like this morning I hear Miss Vũ Thị Hoàng Học Yến. She conducted her model about growing vegetables for the women in the northern areas. But I see that I don't know, I didn't ask her a question, but I just wonder that whether her model will be already connected between sectors. I think if we can connect sector, so it will have larger impacts. Yeah.
And you can talk to the representative from the embassy. Yes, please.
Thank you. That was really interesting. So I know that the Vietnam government has the national targeted programs for ethnic minority communities, and I also know that they've had trouble dispersing some of that money down to the provinces and the districts into activity. Have you seen any evidence of shift in the amount of support coming from the provinces or the districts for these communities to address WASH or health?
In reality, we just have the support from the national government, and the government has indicated that the provincial government authority should nominate budget to support water supply and sanitation for the ethnic minority people. However, the problem is that, like the credit programs, they don't get in the right person. You see that my studies show that the Khmer minority groups are more likely to be landless. But if you want to borrow money from the bank, you have to something, that you can borrow. So I mean that the policy is good there, but the implementations, they need to be examined and need to be more. I think it should be better for the implementation stage. Yeah, and the provincial authority should be engaged in not only the NGOs or the government.
You're not happy with that?
I understand it, but there's three NTPs, the ethnic minority one, the rural development one, and the poverty alleviation one. And my understanding is there's $6 billion allocated to those three NTPs. So I guess maybe we're yet to see the effects of that money in those programs in the communities. Perhaps I'm not sure. And also, we're based in Hanoi, so we often engage with the Committee for Ethnic Minority Affairs as well as the Women's Union on some of these issues. Our focus is in the northwest, where some of our programming is as a livelihood program for agriculture and tourism for ethnic minority. Well, it was essentially because the majority of some of the poorest communities right now, they happen to be ethnic minority, but we do engage a lot with SEMA and the Women's Union. And I guess there's a lot of resources from the central government, but I guess it's just that delay in getting into the communities where it's needed most.
I don't know that if I can share that, because you know that the government provides some funding for the project at the local level, but the access to that is the question. It's not easy. The approval procedure is very complicated. So even with the MONUSA, they cannot use the money for the vocational training.
Yes.
They cannot use it. They still hold the money, but they cannot use it.
And I want to confirm that in reality we have the good impacts on sanitation and water supply for the poor in the southern regions, but some percentage of people who cannot get access to these programs, like the Khmer. So, and another problem is that the sanitation, there is an article talking about that getting access to credit programs for beautiful sanitation types. So it means that technologically we need a model for sanitation or water supply that is simple and easily adapted to the local context, like adapted for the Khmer household. We cannot buy them the sewage system because their house cannot get rainwater from the drainage. So something like that. Yeah. I mean that we need to the policies and strategy specific for the location, for the specific community.
Need more advocacy. Thank you. You have more questions? No? Yeah, please.
Thank you very much for your presentation. It's very useful and it's very
Can you introduce yourself a little bit? And
I
then
think that Khmer people is many ethnic minority in Vietnam. They are vulnerable because they lack of education and economic access. So in the community you have research. I wonder how many people live in this community. How many women? How many girls? And how about their education? Do they go to school? Do the government support their education? And how about their local practice? Do they go to work? How they earn their money? Who is the breadwinner, like the man or the woman? How they make a living? And if we want to provide them intervention program, so how can we do it for long term? Because if we give them money, they spend in one day and that's it. It doesn't help anything.
Yes, you're right. So the evidence shows that ethnic minority have lower capacity, for example, lower agricultural skill or financial management skill. That's right. I asked the local authority in Javin, and the government supported money for the Khmer household to improve their livelihoods, like give money for them to buy a cow. And then when they lack of money, they sell their cow. So the soft skill for the ethnic minorities is also important. So that's why we need a comprehensive policy approach that address multiple sectors, not only one problem like just livelihood access or one problem water supply or sanitation. We need to connect them all. Yeah.
How about the population?
There are around 1 million Khmer households in the southern province. Yeah, and 17% of 1 million Khmer households.
thank you. And any more questions? We still have more than 5 minutes. Any more questions? If not, I have the questions.
I just have a
Okay.
final question. Yeah, I'm very interesting about the intervention. And when you talk, sorry. Yeah, I just think about the intervention. And after you did the research, so when if I ask a question about what's the specific maybe action you think you will do for the intervention, can you tell some on that? Or maybe collaboration, or maybe doing intervention in what area? Yeah, just think about that.
Actually, I'm just thinking about it many times, but I haven't not specified. But I think I am thinking that so as I said, the policies for every sector is there, but we need integrated policies that can connect. Like if I want to improve health for the ethnic minority women, I can, as a public health nutritionist, I cannot stand alone. I am finding the ways to connect with the people working in the agriculture sector, people working in the water sanitation and water supply and sanitation, so that I can together with them discuss the integrated methods or research to help improve the health status and nutrition for the people. Yeah, because I don't want to do something. I don't want to have a siloed approach. Like just providing them knowledge and skill to help to improve their nutrition. It may have impacts, but small impacts. I want something bigger.
As a facilitator, can I jump in the discussion? I'm allowed to do that? Thank you. Because she is a researcher and I'm a social activist. So you can see that because she can read the evidence and the findings. And I think that we need the cooperation, especially the NGO and the local areas. And I think that we have alumni from the Khmer communities. Yes, I don't know, but we need the social activists and the NGO like your NGO, sorry, CKC, yeah, some kind of NGO as a catalyst, and we can use the findings and also cooperate like with you from the business sectors, and we can cooperate. But it needs someone with a passion. But we see her passion. We see it's really clear in her talks and her research, the passion want to make the change in the community, especially for the minority group in the Mekong Delta area. But to do that, we need a lot of resources, especially human resource right now. Like we have policy, we have funding from the government, but we need someone to do it. We need someone to actually take action and do it.
I think the most important is coordination and cooperation between sectors. Yeah. We need to have the same voice, the same aims.
Thank you. We have 3 more minutes. Do you have any more questions? Yes, please.
My name is Minh. I'm actually not working in public sector, I'm in private sector. But I'm thankful for your presentation and your research on minority. But my question is, when you are addressing the issues of the minority, are you measuring the same level of income between the social groups? Or are you generalizing everyone? Because as you know that most of the Vietnamese are clean people, right? And we have a wide ranges of income. And from the income, we have wide ranges of lifestyle and liveliness and sanitation and food security. So are you measuring the same kind of category instead of measuring everyone? So that in the end, when you're addressing the policy and you want everyone to coordinate and help to improve the not equality, I usually use the equity in economics of equity between social groups. But then your focus is on Khmer. Should it be better to focus on a lower income group?
Yeah. Can I interrupt you? Yeah, because maybe I just summarized the methodology so you don't understand what I really did. So my major not aimed at minority group. I investigated in the general population, and then because there is around a percentage of Khmer household in my sample, so I divided them into 3 population categories: northern province-kin and southern province-kin and Khmer, and I analyzed the differences in livelihood access, and it is significantly statistically different between the Khmer and the northern and southern province.
Are they sharing the same?
No. So the Khmer is less advantageous in terms of all the livelihood access. Yeah.
So my basic question is, clean people having the same low level of income would suffer.
They have better level of livelihood access. Yeah.
Thank you.
Thank you. No more questions. So we have the big applause for Dr. Thùy. Thank you very much for your presentation. And we have the second speakers in Vietnamese, so can I transfer to Vietnamese? Người trình bày kế tiếp của chúng ta là cô Quỳnh Ngọc Hồng Nhung, một cái alumnus của Flinders University. Nhung là chủ tịch của hội khuyết tật thành phố Cần Thơ. Cái hội này thì đại diện cho cái quyền lợi và tiếng nói của người khuyết tật ở thành phố Cần Thơ. Nhung tham gia vào hội khuyết tật Cần Thơ vào năm 2001, và từ đó đến giờ thì đã cùng với các đồng nghiệp của mình ở hội xây dựng được khoảng 20 dự án để hỗ trợ cho người khuyết tật. Đặc biệt gần đây là cái dự án được hỗ trợ